So I wanted to, just to give you a little background on myself so you know about me. As he said, I am actually a family practice doctor. Can you hear me? Okay, a little bit louder. I have to depend on the AV guys a little bit for that. So I'm actually in family medicine. I'm not a psychiatrist. I'm not a rheumatologist. I got interested in this because when I was training, it was really interesting because fibromyalgia was not something, well, you didn't say it in polite conversation. It was medicine's F word. And the thing that really fascinated me was that people, senior physicians, could say with an absolutely straight face, well, you know, I don't believe in that. And that really struck me. It's like, well, you know, nobody says, I don't believe in asthma. I don't believe in cancer. And so I thought, well, what is this thing? And when I did my internship, my residency, when you go into academic medicine, that's what I thought I wanted to do, be a professor. When you're family practice, you can't specialize, but you can develop kind of a special interest. And I thought I was going to be the family medicine psychiatrist. And so they have family medicine scope drivers and family medicine dermatologists and family medicine pediatricians. And so I was going to be the family medicine psychiatrist. And I asked my upper levels, you know, if you have patients in your panel that you don't want to treat because you think they have kind of a psychiatric load and you just as soon not have them, then please send them to me. Well, they were very happy to keep their garden variety depression, anxiety, panic disorder. I got two groups of patients. The first were borderline personality disorder, which is an entire academic pursuit of its own. It's not one I chose to go into. And the rest of that they sent me were the fibromyalgia patients. And so I had this whole panel of fibromyalgia patients for 3 years as a medical trainee. And one thing I figured out, you know, this is not a psychiatric disorder. So here I am wanting to be the psychiatrist, and I'm about 50% out of work here. But as I listened to the stories, I have to thank you guys, because you have taught me everything I know. I mean, you gave me the leads, and then I used the big machines to go take pictures of them, and that's what I'm going to show you today. I'm not going to talk about treatment unless you ask me questions about it later. But you told me where to go look, and we struck gold. So now pharma needs to catch up with us. Hopefully they will, but I'm going to show you the gold. So I'm the family practice doctor who has my hobby is taking pictures of your brain. And unfortunately, it costs, the cameras that you use, you know, that costs like millions and millions of dollars. I don't have one in my backyard. I had to do it at the university and up at McGill. So some of these are my pictures, and some of these are other folks' pictures. So the question, first of all, is what is fibromyalgia? I mean, it's a funny word. It's a made-up word, right? It's a conglomeration of little pieces of words. Fibro is fibrous tissue. Myo means muscle. And algia is a Greek word that means pain. So fibromuscle pain. Of course, if you have fibromyalgia, you know that your muscles and fibers hurt, right? So it was natural to use or come up with this word. Well, there's an old word that we use to label a disease none of us in this room have, I'm quite certain. But it's a word that doesn't have any meaning anymore in modern language. It's malaria. And malaria means bad air. And so you got malaria by walking in a swamp. And I'm from Louisiana. I know you walk in a swamp, it stinks because of marsh gas. And the Romans believed by breathing marsh gas, you got bad air disease. And so here's this old Latin term that's just not appropriate anymore. It's a parasitic, you know, it's an infectious disease. Fibromyalgia has nothing to do with fibers or muscles, maybe a little bit, but the majority of it's somewhere else. It wasn't until we invented the microscope that we figured out about malaria. So there's some tools called PET scanners and fMRI scanners, magnetic resonance imaging tools that we use, and that's where we went and found the gold. So if we were to understand fibromyalgia, we might say it's a chronic disorder characterized by abnormal somatosensory, the way you feel your body, processing stemming from changes in the central nervous system, which is a fancy way of saying your brain and spinal cord. Another way of looking at it would be an imbalance between excitatory and inhibitory influences on pain-related pathways of the central nervous system. Again, fancy way of saying spinal cord and brain. So some chemicals that your brain makes make your neurons go fast, and those cause pain. And some chemicals in your brain make neurons go slow, and those typically fight pain. So if you had more fast than slow, more go than stop, you might have more pain than the next person, and we might say that you have fibromyalgia. And some of the chemicals that are used to slow the brain down are accessible by currently approved pharmacologic drugs. And there's some that are out there that right now drugs aren't being used, so there's a lot of room for improvement. So in the basic layman terms, fibromyalgia is a change in the way that your brain and spinal cord listen to your body. So it's a central nervous system problem. So there's a technology called functional magnetic resonance imaging. How many of you had an MRI of some part of your body? Okay. So you know the basic setup. It's a big magnetic tube, and it uses non-X-ray techniques to look at various tissues. The F means functional. We can actually watch the brain do its work. So we ask a question, or we give you a challenge like, don't move while I smash your thumb. And then we watch your brain process this information. So the very first study it made Newsweek. I'm sure that you guys remember, Newsweek magazine, this study came out. This is the picture that came from that. What they did is they took a bunch of fibromyalgia patients and people who didn't have it, and they smashed their thumbs. And they did it in the magnet. They said, sit still. And what they found was that at very low pressure, that a person who doesn't have fibromyalgia doesn't feel any pain. Their brain just doesn't even notice it. And they might say something like, yeah, I can feel it. And then to really hurt a person who doesn't have to have fibromyalgia, in this case, they had to squash their thumb with about 10 pounds of pressure. This is a little rubber mallet, just smashes your thumb. And they go, okay, scale of 0 to 20, that's a 12. I want you to stop. 8 pounds of pressure, or 10 pounds of pressure. So they took the fibromyalgia patients and they said, okay, at this little bitty pressure where the control patients, the healthy folks, they weren't feeling any pain, we're just going to barely touch your thumb. How much does that hurt? 12, stop. Okay, so what would a clinician who doesn't know anything about fibromyalgia say? They're making it up, they want disability, they want to sit on the couch and eat bonbons, right? Well, so the researchers showed that the patient with fibromyalgia, their brain is processing that little bit of information like a big thumb smash with 10 pounds. So they said, fibromyalgia is real. This was the big thing that hit Newsweek, and we were taking pictures of it in the brain. Here's the thing that I always found very interesting about this study. The green on there is a healthy person responding to a lot of pain. The red is the fibromyalgia patient responding to a little bit of pressure. There's a lot of green in an area of the brain that healthy people fight pain. So right there in the dead center of that picture in the middle, that's an area of the brain called the thalamus and the basal ganglia. And you see that the person who's healthy, who's got 10 pounds of pressure on their thumb, has got all kinds of activity. The fibromyalgia patient does not. Okay? So I asked the guy who did this, he's an acquaintance of mine, Rick Gracely. I said, what do you think? What are they doing? Well, fibromyalgia patients are used to hurting, so they just lay still and take it. The healthy person doesn't want all that mess, and so they're trying to crawl out of the scanner. And that's what he thought he was taking a picture of. I said, well, I don't know if I believe that. That's an area of the brain where a chemical called dopamine fights pain. I want you to remember that. So this study has been replicated several times, depending on what you do. This is my friend Dane Cook. He burned patients. So Rick smashed their thumbs. Rick burned them. And there you see that they're lighting up, a little bit of pressure, or in this case, same amount of heat, more activity in the fibromyalgia brain. This is a study that was done in Spain. So this study's been done over and over again. This is a robust finding. As it turns out, if you took 10 fibromyalgia patients and 10 healthy persons and you said, okay, I want you to tell me exactly when you would say, this hurts a 7 on a 0 to 20 scale. And you very carefully measure the pressure, and everybody in the room says that's a 7, the pressure would be all over the place. It'd be real low in fibromyalgia and real high in healthy folks. There's only 2 areas of the brain that differ under those circumstances. There's a little chip at the very front of the brain, you don't need to remember this, called the pregenial cortex, and then a little space down in the brainstem that lights up differently. The pregenial cortex, I do want you to remember, is the thermostat or the barometer for the activity of dopamine neurons. It functions differently, and when you say the pressure is exactly the same, or the pain is exactly the same. So there's another technology called magnetic resonance spectroscopy. It uses the same machine. That's handy. You don't have to buy another $10 million camera. You just buy a several $1,000 software package. What they call this technology is a virtual biopsy. So what that means is, I know that you folks, having worked with a lot of patients over the years, you're very happy to give me a piece of your mind. A piece of your brain, you know, that's probably not negotiable. So we had to figure out a way to go in there and look at the tissue without taking it out of your head. So magnetic resonance spectroscopy turns out very handy for that. The data on MRS is not sexy. It's squiggly lines. And so it's not a big picture of a brain. It's hard to depress you with that. But those squiggly lines tell us information about the chemical content of your brain. So a gentleman, Dr. Ahmad, is an Egyptian fellow. He beat me to the punch. He got this published. He showed that the chemical content in an area of the brain that I have a real interest in called the hippocampus, which controls pain, endocrine function, autonomic function, memory. There's a lot of things that are going on in the hippocampus that smell like fibromyalgia. He showed that chemically, the hippocampus in fibromyalgia patients is different than healthy folks. So then we did the same study. The data looks a little bit different, but it means the same thing. Basically, N-acetyl aspartate, NAA, is a marker of neuronal health. So you want lots of NAA. And as it turns out, those people who didn't have pain had a healthy amount of NAA. You'd expect it. Those with fibromyalgia had significantly less NAA in their hippocampus. So they're the chemically different hippocampus, as I said. Now we said, okay, how sick are you? And we measured that with an instrument called the FIQ, or the Fibromyalgia Impact Questionnaire. We said, okay, how sick is your hippocampus and how sick are you by FIQ? And we compared those 2 numbers. And as it turns out, people were about as sick as their hippocampus was. Now, you could say, well, your hippocampus is about as sick as you are, so you can't say cause and effect. Of course, I think it's the hippocampus making you sick. But if you had a real high FIQ score, you were very sick, lots of symptoms, your hippocampus in pretty bad shape. Those people who had very few symptoms, their hippocampus looked pretty good. So Voxel-Based Morphometry. I just wrote a paper for a journal article come out this December. Voxel-Based Morphometry, again, uses MRI technology, same $10 million camera, different software package. What you do is you look at the size and the shape of the brain by tissue type. So you've got gray matter in the brain and white matter in the brain, and then these holes that belong there. Looks like Swiss cheese, called the ventricles. And we compare the size of that between different patient populations and healthy persons. And so we were actually the first group that did that. And this was our preliminary data that we had published. All those areas that are red, those are areas where the fibromyalgia brain gray matter is changed. It's shrunk up, it's smaller, the tissue's not as healthy. So this was a small sample size, but you see there's a robust area there. That big arc on the left is the anterior cingulate cortex, very important for pain, but also very important for executive function, think fibrofog. Very important for autonomic control, think stress. And then there are the 2 little red dots in the middle there on the bottom, that's your hippocampus, it's shrunk up. And then the insular cortex and some areas there on the right. So this was the very first study that demonstrated that.